Namaskar everyone, welcome to our channel. Today we are going to explore an important classical Ayurvedic formulation, that is Tribhuvan Kirti Ras. In this video we will understand its classical variants, ingredients, preparation methods, therapeutic uses and modern research studies related to this powerful Rasashastra medicine. We will also discuss its role in Jwara, respiratory disorders, chronic sinusitis, antioxidant activity, and recent scientific perspective. So, if you are a student of Ayurveda, Rasashastra, researcher, or Ayurvedic enthusiast, this video will be very useful for you. Please watch the video till the end, and if you find it informative, don't forget to like, share and subscribe to the channel. Let us begin. Tribhuvan Kirti Ras. Tribhuvan Kirti Ras is a classical Ayurvedic herbal mineral formulation, mainly indicates in Jwara, Sannipat Jwar, Kas, Pratikshay, Kapha-Vat disorders, mentioned in many classical Rasashastra texts, known for its Alpamatra Prayog, Kshipra Karya and Deepan Pachan action. Here mainly contains in it Hingul, Vatsana, Trikatu, Tankan and herbal Bhavana Dravya. Objective of this presentation is to study different variants of Tribhuvan Kirti Ras, also to understand the classical preparation method, to review pharmaceutical processing, to analyze modern research article and to understand the standardization, clinical efficacy, antioxidant activity, and also use this formulation in pandemic supportive applications. Now we see the first variants. Reference of these first variants is Yog Ratnakar, also Rasayar Sar, Chikitsa Sar, Rasendra Chudamani, Nigantu Ratnakar. Here is the shlok. Hingulascha Visham Vyosham Tankanam Magadim Shikham Sanchurnya Bhavaye Tredha Surasadrak Hemabhihi Rasas Tribhune Kirti Gunje Ka Adrak Rasenavai Vinashe Jwaran Sarvan Sannipatascha Trayodasha. Here is the ingredients are Hingul, Visha, that is Vatsanap, Vyosh means Trikatu, Marich Shunthi Pipali, also use Tankan, Magadhi means Pipali and Shikha means Pipali Mul. Preparation method: all ingredients are powder form, then subjected to bhavana 3 times each with sursa, that is tulsi juice, adrak, swaras and hema means dhattur juice. Mention here dose is a pill about 1 rati, that is 125 milligram, and administered with fresh ginger juice. Indications are here, which is effectively against all type of fevers, especially useful in Sannipat Jwar. Now we will see here second variant, Tribhuvan Kirti Ras, and reference from Rasa Prakash Sudhakar, Rasendra Chudamani, Adhikar Udar. श्लोका शुद्धस्य ताम्रस्य दलानि कुर्यात् फलानि त्रीण्येव च गन्धकस्य फलाद्वयं वै रुचकस्य च एव फलं रसस्यापि विमर्देत् खल्वे चूर्णं विधायाच्च च सिन्धुवारप रसेन पत्राणि विलेपयेच्च तत्सम्पुटस्थः अन्तरतो निधाय विमुद्य तत्सम्पुटेन वह्नोः यामं तथैकं च गणैः पुटेत् ज्ञातं सुचितं हि विचूर्णयेच्च तत् नागवल्ली दलं मध्यतोपि वल्ले एकमात्रं सकलो उदरग्नम. Here ingredients are शुद्ध ताम्र 3 पल, गंधक 3 पल, रुचक means संवरचल, that is black salt, use 2 pal, and शुद्ध पारद taken as a 1 pal. Preparation method: first prepared kajjali, mix with other powders. Also this powder all formulation levigates with Nagvalli juice. Apply over copper lutes. place inside samput, subjected to put for 1 yam, that is in approximately 3 hours. After swangshit, grind this powder into fine. Dosage is here 1 valla, that is approximately 3 ratti, means 375 milligram, administered with Nagvalli Swaras. Indication: effective against all abdominal diseases and enlargement, that is Sakal Udaragnam. Now we see here third variant. Reference from Rasashastra Saram in Jwara Adhikar. Mukta Suvarna Daradau Visha Tankanaucha Vyosham Rasena Dahanasya Dinam Samurdayam Churno Akta Jirnam Ghata Madhyagatam Nirundhya Alapam Putescha Bhavana Kirti Resham तद्यो ज्वरग्रहणी कासक्षय सन्निपात अतिसारमेह अखिलानिल कासकेषु स्वस्वानुपानम अथवा मधुपिप्पलिभ्यां पथ्यम तथैव हितमस्य ददित कुंजाम. Here mention the ingredients in it, that is mukta, swarna, darad means hingul, visha means vatsanab, and tankan means borax, and vyosha, that is a trikatu. Method of preparation is here: take equal parts of all above ingredients and grind into a fine powder. Triturate with the juice of dahan, that is a chitrak, for 1 full day. Shape into a ball and place inside an old earthen pot coated internally with lime, that is churnadak. Seal the pot and subjected it to alpaputa. After swangashit, collect the medicine for utilization. Here standard dose is 1 gunja, to be taken with suitable anupana depending upon the disease. Commonly administered with honey and pipali powder. Here mention the indications is Jwara, Sannipat Jwara, Grahani, Kshay, Atisar, Prameha, Vatvyadhi and Kas. Now we see here fourth variant, and reference from Rasamrit Rasayog Vigyan chapter 9. Shlok is the Hingulam cha Visham Vyosham Tankanam Magati Shifam Sanchurnya Bhavaye Tredha Surasa Adrak Hemabhihi Nirgundi Swarasenapi Rasa Trailokya Kirtikaha. Here is the ingredients: hingul, Shuddha Visha, Shunthi Marish Pipali, Shuddha Tankan and Pipali Mol. Method of preparation: all dry ingredients are finely powdered and mixed, subjected to bhavana 3 times each with tulsi swaras, adrak swaras and dhatu swaras. Additionally, these variants specified bhavana with nirgundi swaras and making the pills. Dosage 125 to 250 milligram approximately, that is 1 to 2 ratti, administered with honey, tulsi juice or adrak juice as a anupana. Therapeutic uses: primarily indicated with Vata Kapha Jwara, acts as a potent antipyretic and balance aggravated doshas. Now we see comparison of these 4 variants. In these, first variant which is used for fever, second variant used for abdominal disorder, third variant which is broad spectrum activity like in fever, grahani, kshay, atisar, prameha, kas, and fourth variant which is especially for Vata Kapha Jwara. Now we see here some articles. First article is titled Efficacy of Ayurvedic Medicine in the Treatment of Uncomplicated Chronic Sinusitis. This study was conducted by Dr. Hemant Kumar Panigrahi and published in Ancient Science of Life in 2006. Here, in introductory part, sinusitis is a common condition in which sinuses becomes inflamed due to infection and mucus accumulation. In Ayurveda, this condition resembles Suryavarta, mainly involve Vata and Kapha dosha, and the purpose of this study was to evaluate the effectiveness of Ayurvedic treatment in chronic uncomplicated sinusitis. Here, medicine used in this study use Tribhuvan Kirti Ras given in the dose 250 mg twice daily with ginger juice, Dashmul Quat steam inhalation. Also, Anutel Nasya 4 drops instilled with into both nostrils after steam inhalation. Study design here is total 30 patients were selected. Patients were between 18 to 62 years age. Treatment duration was 90 days, and investigation, X-ray investigations and clinical examination were done regularly. Important findings in it: before treatment, patient had headache, nasal block, facial pain, purulent discharge, sinus tenderness, and radiological finding shows sinus haziness, mucus thickening, and air fluid levels. Results of this study showed excellent improvement. Symptoms started reducing from the second week. Many patients became symptom free within 25 to 45 days, and also X-ray shows proper sinus drainage and disappearance of inflammation. Overall success rate clinically is a 96.6%. That is 29 out of 30 patients improved significantly. Here, probably mode of action of Tribhuvan Kirti Ras, that is work as a Pachan, Dipan and anti-inflammatory medicine, and no side effects and adverse reaction reported during this study. This indicates that Ayurvedic treatment was safe, effective and well tolerated. Conclusion of this study that Ayurvedic management using Tribhuvan Kirti Ras, Dashmul Quat steam inhalation and Anutel Nasya is highly effective in chronic uncomplicated sinusitis. The therapy helped reduce inflammation, improve sinus drainage and relieve symptoms without side effects. Now we see other article, that is a study on standardization of Tribhuvan Kirti Ras, which is published in 1996 by Dr. Agrawal, Joshi, Pandey. Aim of this study this study was to standardize the Ayurvedic formulation, that is Tribhuvan Kirti Ras. Researcher performed chemical analysis, organoleptic evaluation, thin layer chromatography and identification of ingredients to establish quality standards for the medicine. Here the article states that Tribhuvan Kirti Ras is widely used Ayurvedic herbomineral medicine, which is mainly used in fever, sannipat, jwar, cold, coryza, Vata Kapha disorder. Here used ingredients includes Vatsanap, Shunthi, Marich, Pipali, Pipalimul, Hingul, Tankan and Bhavana Dravya, that is Tulsi Swaras, Adrak Swaras, Dhatur Quat and Nirgundi Quat. Preparation method, here is the part from the Rasamrut. Important Samskara use repeated Bhavana procedure with Tulsi Swaras, ginger juice, Dhatura decoction and Nirgundi decoction, and final product was shaded dried. Analytical study performed here. Researchers tested Hingul identification, Borax identification, Vatsanap identification by thin layer chromatography use, and observe in purified Vatsanap and final Tribhuvan Kirti Ras. Findings here: organoleptic characters, final product shows dull yellow orange color, faint smell, fine texture, acrid taste. And chemical findings: total ash is 15%, mercury 10.21%, sulfurs 1.93%, borax 9.77%, oil content 0.3%, total alkaloid 0.02%, pH is a 8.40. Interpretation of this result: the study confirmed presence of all major ingredients here, proper pharmaceutical processing done, and standard chemical profiling is here. The unchanged oil content suggests fresh herbal material were used during Bhavana process. Importance of this study because it established quality standards, validates classical preparation method, helped in scientific standardization of Ayurvedic medicine, confirmed ingredients authenticity. The study concluded that Tribhuvan Kirti Ras can be scientifically standardized using modern analytical methods. TLC and chemical analysis confirmed the presence of important ingredients, and Bhavana Samskara played an important role in formulation quality. Thus, the article supports the scientific validation of classical Ayurvedic formulation. Now we see article 3rd, that is mitigating COVID-19 with Ayurvedic Rasashastra Vigyan, published in World Journal of Pharmaceutical Research 2020. This article discusses how Ayurveda and especially Rasashastra concepts may help in prevention, immunity enhancement, symptoms management during the COVID pandemic. The article was written during the early phase of pandemic and tries to correlate with modern understanding of COVID-19 with Ayurvedic concepts like Shleshma Krumi, Jangam Vish and Kaphavat Jwara. Now we see here modern view of COVID-19 is a viral respiratory disease caused by SARS-CoV-2, spread mainly through respiratory droplets, and common symptoms mentioned here: fever, dry cough, breathlessness, sore throat, body ache, fatigue, diarrhea, loss of taste and smell, and maybe in severe cases leads to pneumonia, lung disease and cytokine storms, also in death. Mechanism of coronavirus explained here. Virus enters human cell through ACE2 receptors. It mainly affects nose, lungs, respiratory tract and intestinal lining. So loss of smell and taste occurs here, and virus affects olfactory and taste receptors. Now we see here Ayurvedic correlation of COVID-19. The author compare COVID-19 with Shleshmal Krumi. According to Ayurveda, Krumi means microorganisms. Shleshmal Krumi are kapha-dominating infectious organism. COVID-19 symptoms resembles cough accumulation, respiratory obstruction and fever and cough. Also Kaphavat Jwara, symptoms similar to Kaphavat fever include Sheet Gaurav, Tandra, Kas, Pratishai, Shiro Gaurav. As disease progress, all three dosha become involved. It may resemble Sannipat Jwar. Ayurvedic principles suggest here three main Ayurvedic approaches: self-isolation, health, diet and lifestyle, and third, immunity enhancement using Rasayan, herbal decoction and Rasaushadhis. Role of Rasashastra emphasized here because it mentions classical statement Alpamatra Upayogitvat Kshipram Arogyadayitvat, means use Rasashastra in very small dosage, fast action and highly potency. The authors claims here Rasa medicines acts rapidly. Minute particle size may help quick systemic action. So the important medicines mentioned here, first is a Sanjeevani Vati, which suggests the action Deepan Pachan, anti-inflammatory and antimicrobial, used for fever, digestive disorder, respiratory symptoms. Also use Sanshamani Vati. Main ingredients here, that is Guduchi, claimed benefits, immunomodulator and useful in fever and viral illness. Also use Jai Mangal Ras, used in chronic fever, Visham Jwar, claimed to support heart, brain and lungs. Also use Shwet Parpati, mentioned for removing toxins and improving urinary elimination. And fifth one is a Tribhuvan Kirti Ras, claimed action is relief in fever, cold, cough, body ache. The article suggests possible useful in viral respiratory condition. 6 is a Ashwagandha, described as a immunomodulator, antioxidant. And 7th is a herbal decoction combination mentioned here, Ashwagandha, Guduchi, Tulsi and Shunti, which claims the action as a antipyretic, respiratory support, immunity enhancer. Also use here Shirish, suggest for detoxification, respiratory congestion and nausea use. The article argues here, along with modern medicine, Ayurveda and yoga may help improve immunity, reduce disease severity and support recovery. The author focused mainly on host immunity strengthening rather than directly killing the virus. Important observation in this article is not a not a clinical trial and not proof of cure for COVID-19. The paper mainly purpose for Ayurvedic interpretation, possible supportive roles of Ayurvedic medicines based on classical concept. And the author concludes here, Ayurveda and yoga may contribute in prevention, immunity enhancement, supportive care during pandemics. They especially highlights Rasayan therapy, Rasa Aushadhi, lifestyle regulation as supportive measures. Now we see article 4, that is innate antioxidant activity of some traditional formulations. Authors are Gunpreet Kaur, Vikas Gupta and Parveen Bansal, published in PubMed. In this article studies the antioxidant activity of some commonly used Ayurvedic formulation. The researcher wanted to scientifically evaluate whether classical Ayurvedic medicine naturally possess free radical scavenger activity, reducing power and antioxidant potential. Why antioxidants are important inside the body? Free radicals are continuously produced. Excess free radical cause cell damage, inflammation, aging and degenerative diseases. Antioxidant helps by neutralizing free radicals, protecting cells from oxidative stress. And the study aimed to determine whether Ayurvedic medicine can act as a natural antioxidant. Aim of this study to evaluate the innate antioxidant activity of some traditional Ayurvedic formulations. Formulation studies here, the following Ayurvedic formulation tested, that is Lakshmi Vilas Ras, Agnitundi Vati, Ajmodadi Churna, Tribhuvan Kirti Ras and Sitopaladi Churna. These were compared with gallic acid, which is used as a standard antioxidant. Method used in this study, researchers use in vitro laboratory method. 2 major tests were performed. First is a reducing power method, that is this method measures ability of the drug to donate electrons, and the higher reducing power means better antioxidant potential. And second method is a superoxide radical scavenger activity. In this test checks the how effectively the formulation neutralize harmful superoxide radicals. The dimethyl sulfoxide means DMSO method was used here. Also use IC50 value. The study calculated IC50 percentage, that is inhibitory concentration, means amount of drug needed to inhibit 50% free radicals. Important point is here, lower IC50 value is a stronger antioxidant activity. Result of this study, reducing powers, means among all formulation Lakshmi Vilas Ras shows highest reducing power, strong antioxidant potential. And second method, use all formulation shows antioxidant activity, and here IC50 values observed where chart is here. लक्ष्मी विलास रस 50, IC 50 value, Agnitundi Vatti 98, Ajmodadi Churna 105, Tribhuvan Kirti 116, Sitopaladi 200. Interpretation of this result: since lower IC 50 means better antioxidant activity, the study suggests best antioxidant activity. Here the interpretation of this result: the study suggests best antioxidant activity in Lakshmi Vilas Ras, moderate antioxidant activity in Tribhuvan Kirti Ras and Agnitundi Ras, and comparatively lower in Sitopaladi Churna. The study scientifically supports that the classical Ayurvedic formulations naturally contains antioxidant properties. Their therapeutic effects may partly occur due to free radical scavenging and reduction of oxidative stress. Importance here, the many Ayurvedic formulations are traditionally used in fever, respiratory diseases, inflammation and weakness. The antioxidant activity may help explain Rasa effect, tissue protection and disease prevention. So the authors concluded that all tests Ayurvedic formulations showed antioxidant properties. Further studies showed identify exact antioxidant compound and mechanism of actions. So friends, in today's video we studied the classical variants of Tribhuvan Kirti Ras, its ingredients and pharmaceutical processing, therapeutic applications and modern research finding. We also understood how classical Ayurvedic formulations are now being scientifically evaluated through standardization study, clinical research and antioxidant analysis. I hope this video helped you understand the subjects in a simple and clear manner. If you found this video helpful, please like, share with Ayurveda students and health friends, and subscribe to the channel for more Ayurveda and Rasashastra education videos. Thank you for watching.